again for tuning in to We Heart Therapy. You're watching the series EFT Talk. I'm Anabelle Bugatti. I'm a licensed marriage and family therapist and a certified EFT therapist. You probably noticed this wonderful woman sitting next to me, Dr. Sue Johnson, the pioneer of emotionally focused therapy. And what an honor today it is for us to be on our show. Thank you so much, Dr. Sue, for being with us.
Hey, you're most welcome. I'm happy to be here.
Thank you. So we're going to talk today about why choose EFT as a model. You know, there's lots of therapists who are seasoned, but maybe they're not seeing the results they'd like to with their couples, or even, you know, new therapists in grad school who are hungry for something that gives them more precise step-by-step, how do we help people? So help us with how EFT is so awesome.
Well, I'm a bit biased, you understand.
Well, so am I, obviously.
Okay, but there's lots of reasons, actually, to choose EFT. EFT is best known as a couple therapy. And couple therapy has the reputation, and I think it's an okay reputation, for being pretty difficult in terms of modalities, because you have a lot of emotion in the room, lots of drama. You have two people in the room who see reality from a whole different point of view. Therapists are usually worried about escalation. They're worried about too much emotion. The picture changes all the time. People have different narratives that mean different things. They interact in a difficult way. So couple therapy has actually been called trying to pilot a helicopter through a tornado.
Feels like that.
Yes. And I think if you don't have a map, that's not a totally biased view of couple therapy. It doesn't have to be like that, but I think that's kind of what it can be, right?
And I think that's where a lot of therapists get really hungry, because, you know, CBT, you know, a lot of these other models don't give you a map. They just say, well, here's kind of some theory. What to do with the symptoms. Yeah, and you get in the session, you're like, okay, what do I do with this big mess in front of me?
That's right, you have to have a map. With couples in particular, we work with individuals and families too, but we've written about that less. But with with couples, things become pretty heated, and there's these big existential issues that are there. Not just, they look like they're fighting about who's going to pick up the kids, but if you really listen to it, they're fighting about, am I a lovable human being? Am I going to live the rest of my life alone? Do you care for me at all? Can I count on you? Or am I caught in this dreadful place where I'm in a relationship and I long to be close, but in fact I'm lonelier than I've ever been in my life? So there's all these big issues coming up. I think the main thing that EFT does is it gives the therapist a map, because we are the only form of couple therapy that is couple and family therapy that is based on a clear, rich, reasoned, researched science of bonding relationships. And so we are standing on thousands of studies of bonding between mother and child, between adult partners. We are standing on all this science that tells us how to make sense of these emotions, that tells us, what these fights are all about. Are they really about parenting and the fact that these people have different personalities? No, they're not. They're always about attachment. They're about the security of the attachment. Are you there for me? Can I count on you? Do I matter to you? Will you come when I call? The couple don't even know what they're fighting about most of the time. So we have this map, this way of understanding the emotional music that's driving the dance and the dance. We say the problem is emotional disconnection and the consequences of that, not conflict per se. Conflict is the inflammation, the virus is this loss of emotional connection.
And couples will always fight. We can't stop them from having fights, and that's what I think a lot of couples walk into therapy thinking, you're going to help us not fight anymore. That's not it. And somewhere underneath, when you talk about the emotion, and from working with couples, they get a sense, even though we're bickering over the dishwasher, it gets so heated and blown out of control because underneath it all, at least one of them is usually aware it's not about the dishwasher.
That's right.
It's about something else.
And so what we say in EFT is, we know how to go to the heart of the matter. we don't spend a lot of time trying to contain symptoms, trying to say, oh, here's what you can do when you're really upset with each other to be not so nasty to each other. That's a waste of time. Because when they're caught in the emotion, they're going to do what they do, right? Therapy, the therapist's advice just is so not powerful, is just blown away in this wind of compelling attachment emotion. And we teach you in EFT to understand that and to have a map. So that's the first big reason. EFT is based on a very substantial science of love, loving, and bonding. And that's huge. And one of the reasons I'm obsessed with attachment science, I love the science. I love the clarity of the thought. But if I'm honest, the reason that I am obsessed with attachment science and that we have developed along with that science, and now we've actually started to contribute to that science, is that it never lets me down in a session. When I say to myself, you know, what is happening here? Or, you know, what is going on with this person that they're taking this crazy stand? If I really go into the attachment channel and listen to, you know, my understanding of our attachment fears and needs, I always get it. And I always get what's really happening. You know, like a lady said to me last week, I am incredibly angry. I'm angry all the time. And I said, And she said, I don't even know why I'm angry. And I said, no. And then she said, do you know why I'm angry? So that's a very good question. You know, and it was a great relief to say, I think I do. Why don't I run it past you and you tell me what you think? I think I do. You know, and so we, for example, we understand the amazing urgency and the pain that comes along when someone you love turns their back on you. We get that. We get that pain.
And part of, you know, one of the core aspects of EFT is that everything makes sense, right, when we filter it through the attachment lens.
That's a lovely way to put it.
So, and that's why I like it, because we're not sitting in session saying, why is this client getting so angry? Why is this wife yelling at her husband and using these words? Why do these things blow up? It makes sense. If it feels like you're saying I'm not important, it makes sense why I would get so upset about that, right?
But the other thing that we've done is we've added to that science by, over the last 30 years, we've created very systematic interventions. And we know how to teach those interventions. We've developed a whole way of helping you learn EFT, the 4-day externships. We get, how many? I can't remember now. I think we have about 3,000 people every year doing the 4-day externships in North America. We have this way of showing you exactly what to do when, to have systematic but flexible interventions that we can teach you. And I think that makes a lot of difference, because then you go into a therapy session with some confidence. You're not sitting like, oh no, what do I do now? You know, we say, if you get lost, here's what you do. You go back and you listen to the emotional music, you reflect the emotional music. When this is happening, here's what you do. You help the couple turn and create an enactment. So we have very systematic interventions. But the third reason why you should do EFT is incredibly simple. We've tested our interventions up the wazoo. Do you guys use that phrase?
Yes.
we tested our interventions up the wazoo. We have the best research in the field. We can show that not only what we do works, we can show that there's certain conversations, we call them hold me tight conversations, that if you help the couple have these conversations, that they will be fine at the end of therapy and they'll be fine years later. We are the only couple therapy that has great follow-up.
Yes, and that is a big distinction. So a lot of therapists, you know, the movement is more towards the evidence-based or the research-based, but again, it's in terms of actual research, EFT is unparalleled by any other model in terms of actual outcome research on the techniques, the interventions, and it's been shown to be effective not only in the short term but the long term.
That's right. And you know, I think therapists, they look at these big research studies, and I can understand this because I'm not just a researcher, I'm a therapist.
Sure.
They look at these big research studies and they read them, and there's this sort of jargon and, you know, these means, and the therapists say, what does this have to do with John and Mary who were driving me crazy in my office? And I think that's fair enough. But, you know, what I want to say to those folks is, we try to keep EFT research clear, we try to keep it clinically orientated, and we have learned so much from our research. You know, our research it has been driven by clinical work. You know, it's you know, like, can we make a difference if one partner is depressed? And our latest study, we've done a brain scan study for those folks that are interested in the brain. You know, and our latest study I'm very proud of is that we've shown that not only can we change relationship satisfaction, things like trust and intimacy, in a way that lasts 2 or 3 years down the road, but we can actually help people move into more secure bonding. And more secure bonding is associated with every indices of mental health and good functioning that you can ever imagine. It's associated with confidence, with the ability to take risks, with the ability to explore the environment, with empathy, with assertiveness, with on and on.
Psychological well-being.
Yes, that's right. That's right. So, you know, we have the research, we have the clear clinical interventions and the rationale behind them, and we have a clear theory of love. And the other thing the research has done, which sounds a bit funny, is we've actually shown that our theory, the way what we think is creating change, is actually what's creating change. Like, in other words, our theory fits the changes we make, which is a big deal.
Yeah.
Because there's some studies, for example, with the more behavioral approaches that say, no, actually, some sort of change happened here, but it has actually nothing to do with proving that people's thoughts are irrational, or that, in fact, that didn't help at all. It made everything worse.
Yeah.
So, you know, knowing that you are doing what you think you're doing, and that you're sort of clear and coherent from your theory-based, that everything hangs together, I think you would be hard-pressed to find an approach to psychotherapy that has more internal coherence than EFT. And the one thing we haven't done, which we're going to do, it takes a long time, this stuff, you know, is we need to write more about our family interventions and test them, and we need to write about more the fact that we work with individuals. I have a new book coming out next year where I talk about individuals, and I think if I do another big outcome study, I will do an outcome study on individual. It's actually, it sounds like EFT, Emotionally Focused Individual Therapy, which sounds like EFT, which I kind of like. Sounds like a new gym,
cool.
a new gym program.
We're gonna go to therapy and get EFT. That's
Let's get emotionally EFT.
Yeah.
I think the other thing about us is we've taken the most powerful thing in the room, which you know, the psychotherapy field has been quite ambivalent about. I think lots of times psychotherapy has tried to really contain emotion or dismiss it or avoid it. But we know how to take the most powerful thing in the room, which is emotion, and not just help people regulate it, but help them use it to create change.
Yeah, because emotion is so salient, and as you know, EFT teaches us, it gives us important information about the attachment relationship.
Absolutely.
You know,
and it communicates, and it also is an enormous motivator. Like somebody said to me the other day, I think it's quite a good question actually. A journalist said to me the other day, well, you know, how do you get a partner who's been hurt and you know, maybe betrayed and maybe disillusioned, and they're in your office because they don't want to split up their family. But how do you ever get someone like that to really risk and really? Your therapist must be very clever. And and I said, no. Our therapists are very clever, but no.
They're methodical.
Yes. I said, no, that's not the point at all. You don't understand. We pick up the most powerful instinct in man, and we use that to get that person to take a risk. It's called attachment longing. And if you know how to prime attachment longing, really, people will, if you know how to prime attachment longing, people will take the most amazing risks.
Yeah.
They'll blow your mind. But it's not because we're clever, it's because we plug into this powerhouse of survival-orientated instincts. That's how we do it. So actually, there's a lot of very good reasons. I'm glad we're doing EFT.
Yeah, I am so glad. So, in terms of the research, when you're looking at models of counseling and you want to go to the research again, EFT has not only had research on attachment theory itself, but you've done a lot of hard work to understand couples and to build these interventions, and then you've tested the interventions to see if they're effective, which is a huge difference between EFT and other types of research-based modalities, is that our interventions have actually been tested and found to be effective.
Yes, these days everyone's is suddenly evidence-based, if you've noticed.
Right.
Which is just saying, well, actually this therapy has some justification in some piece of research somewhere.
Right.
But that's not the same as saying, we've tested our interventions and found that they work.
Yes.
They actually work.
And that's the point of doing it, is because we want to help people and know that what we're doing works. It's effective not only now, but long term, that the change holds. That's huge.
And the latest research, and it wasn't a study by us. Ours is coming out hopefully soon. But the latest piece of research to come out was actually on our relationship education program, Hold Me Tight. It's just out in the Journal of Marriage and Family Therapy. It's done by a group of researchers in the Netherlands, and it's looking at the effects of our 16-hour education program, which people often give in a weekend actually, called Hold Me Tight, the educational program, and the results were great.
That's excellent.
So to know. And the next study I do with my colleagues will actually be in Ottawa. We're doing a study with the Heart Institute in town. And we're using the Hold Me Tight educational program with cardiac couples.
Nice.
And we've already got some preliminary data. It looks really good.
That's great.
And now we're putting in for a big grant. We're going to do a big study because the medical profession is waking up to the fact that attachment is biology. And
they've known for some time that psychological resilience, the fighting spirit, has a big difference in those terminal patients who are able to beat the odds and fight the illnesses. And from what we know from your research is that secure bonding increases that psychological resilience. So secure bonding saves lives.
That's hey, I like that. That's very good. Right.
It
That's
does.
Right. So we're both kind of agreeing here that EFT is the way to go.
Yes.
I think so
too.
Yes.
Yes. So, just again to connect some of the dots, for those of you, if you see Dr. Sue's research, and you can go on to ICEEFT.com, she has a nice tab devoted to all of the research, one handy place. And there's study after study after study on PTSD, eating disorders, childhood sexual trauma, some of the debaters of, attachment theory, like to say, oh, it's not all about attachment. But Sue has proven that it absolutely is all about attachment. And while people may still, experience mental illness, even in the face of secure bonding growing up, secure bonding has everything to do with how they can cope with terminal illness, with trauma, with the stress of life that happens outside of the relationship, because again, the secure relationship creates that safe haven, the secure base, and that has everything to do with how we live as an individual and how we pilot our relationships as a couple.
The bottom line is, your nervous system is the nervous system of a bonding mammal. and you are not wired to deal with the stresses of life
Alone.
all by yourself. And that's just the way it is, you know, and the sooner we really understand that and start to take account of that and to even use that in psychotherapy, the better.
And EFT integrates neuroscience. So for those of you who are looking for the real scientific edge, you know, some kind of hardcore proof, look at the neuro study scans that she's done, the fMRI scans, you know, it's all there. You know, EFT is also highly integrative, right? It's, you know, attachment is what gives the meaning. You know, it's what everything is laid against the backdrop, but it also incorporates other skills, you know, a little bit of Gestalt where we're picking out the body movements, getting in tune. You know, the humanistic perspective, it's systemic, you know, so we have some systems theory in there. So it is integrative already in and of itself.
Yes.
So, you know, couples or therapists looking, you know, if they're looking for something that sort of captures a lot, EFT already encompasses everything they need to know.
Well, I wouldn't say that I'm
Almost
sure we'll
everything.
find.
We'll keep finding, but we found the basic.
We're exploring, and we keep exploring, and we keep looking at different things, right? So I think the medical stuff is very interesting.
Yes.
For us to look at how we can help couples who are dealing with, you know, if your partner gets sick. It's a couple issue, it's not just an individual issue, right? And you can use the couple relationship, you can create a team so the couple can stand together against the illness.
Absolutely, absolutely. So why choose EFT? It gives you a clear and coherent roadmap, not only just for the general trajectory of where do we start in therapy and where do we end up when the couple, you know, hopefully graduates from therapy, but also an in-session map where specifically you know how to work through each session regardless of the content. It's process focused.
Right.
And the goal is to move from insecure attachment to secure bonding and secure attachment together. And EFT gives you the roadmap and all of the research to back up and show that it is effective. And that's why we want to use it.
Hey. I think we should go out and celebrate.
Yes, absolutely. Make sure that you check out ICEEFT.com for more information. Dr. Sue, what's the name of your book that's going to be coming out?
Oh, it's going to be called Safe and Sound.
Safe and Sound. Oh my gosh, I'm so excited for that.
Well, I have got to finish it. I got to revise it first. I hope I like it when I read it.
Somewhere around 2018?
I don't know. Yeah. I think if I finish it in the next few weeks, the publisher promises me that it will be out in 2018.
Excellent. So look for her new up-and-coming book. You can also go to her website and find some of her previous studies and books that she's written. Love Sense was one of the last ones that she wrote. Incredible book. You can also find it on Amazon. Thank you again so much, Dr. Sue, for being part of our show. It was so much fun. You're welcome anytime. Please come back.
Okay.
Thank you, everyone, for staying tuned to We Heart Therapy. Make sure that you subscribe. More videos are on the way.